Plan B is an online patient-held care plan, which is designed to help people with advanced cancer become more active and take ownership of some of the care, both medical and holistic. So the project itself grew out of the Manchester Cancer Innovation Fund, which was supported by Macmillan, and we had 1 year to develop the website and test it with patients. And we decided to test it with a group of sarcoma patients who come to a clinic in Manchester run by Dr. Mike Leahy. The website is made of 3 parts. There is, first of all, a registration and what we call a Plan B school, where individuals can log on, they're given a unique login, and access multimedia resources to learn how to use Plan B to its best effect, and learn in particular about how to use the library and the evidence that's placed in there. And that is in fact the second part of the website. So there are 6 different domains which include different topics, and you can, as a patient, research these topics and decide which one of these areas that you think you want to invest your time in. So for example, there's information about diet and nutrition, there's information about exercise, there's information about your cancer therapies, which includes alternative therapies, and so on and so forth. Each of the topics in the library is given an approval score, so that's either 3 thumbs up, 2 thumbs up, 1 thumbs up, or no thumbs up. So we're not telling people not to pick something, but we're suggesting that in some instances there's more evidence to suggest that this item is better for you. For example, particular diets we might give 3 thumbs up to because we think they're quite good. Physical exercise we might give 3 thumbs up to. But for something like Reiki, for example, we're not saying don't do it, but we're suggesting that there's not as much evidence base to suggest that it's something that might improve your health. And we're also looking at some of the more controversial things like cannabis oils, for example. So it's very much the patient taking control, it's very much the patient making a choice. And the third part of the website is what we call a Plan B schedule, and that is the active care planning section. So you pick items from the library, you place them into your Plan B schedule, and your Plan B schedule will then prompt you on a daily basis, have you achieved this? So let's say you've picked yoga, you pop yoga into your schedule, and it'll come up with a little calendar that says, on Monday, did you manage to do 20 minutes of yoga or not? Tick, yes I did, or no I didn't. There's no punitive measures, it doesn't matter if you don't do it, it's entirely up to you. It's basically a way to organise your time. And we know that a lot of patients are accessing information through the internet, whether it's Google, whether it's through social media. And this is a way really to sort of bring all that stuff together and enhance the patient experience and create a better outcome by getting the evidence that we want patients to read in one place and to give them a tool to actually do the care planning. The future for Plan B, I think, is bright. There is another year worth of redevelopment and testing, in my opinion, and I'm hoping that we'll be able to find some resources to enable that to happen. I think it would be nice to test the system with other patient groups. So far we've only tested it with our sarcoma group, but I think something like this could be rolled out very effectively for maybe metastatic breast cancer, for example. I think once that year is up, we may have a system that could be implemented at any cancer service across the country, because obviously it's online, it's not in the real world, but there would need to be some commitment and some support from host organisations to support it, because although this is very resource light, it does require integration with the activity in the actual clinic for that disease type. So nurses need to know about it. It needs to be referenced as part of consultations, because otherwise you'll find that patients disengage from it because it doesn't feel like it's part of the offer that we're giving to people.